The United States of America has the world's most right-wing healthcare system, and I think it's worth looking into. You know, how did that get started? Why is it so? So whenever people say things like, well, the Republican Party, they don't have a plan on healthcare, they have a plan. It's our current system. They like our current system because there's not a health insurance system in the world that's more right-wing than ours is. Basically, if you can afford it, you can live. People who have serious medical illness, they'll go tens of thousands of dollars into debt, six-figure debt for medical illness. So the third leading cause of debt in the United States of America is medical debt. That is fucking insane. There's not a country on the planet where you could say that about. To even pretend that Mitch McConnell and Paul Ryan were going to change healthcare or do anything about healthcare, mess with the status quo in any way. America has no price caps on pharmaceutical drugs. We have no price caps on hospital services. We have no price caps on doctor salaries. We have no price caps on how much health insurance can. We have no price caps on anything. You can't even say, oh, well, one hospital, they charged $5 for a bandage, the one right, which is still too much, but the one right beside them charged $500. You can do that. And unless it just gets particularly egregious, like Martin Shkreli, there's not a lot that's going to be done to you. So why does America have this employer-based health care? Basically, it starts with World War II. The rest of the civilized world is leveled. It doesn't have any money for anything, so employers didn't have the money to give out health insurance, so the government had to step in and do that. In the United States, it was the opposite problem. There was all these amazing jobs and employers were fighting over people because we were mostly left completely undisturbed by World War II. No other country in the world could really say that except us in Canada. Employers fighting over people through salaries, and it was getting to be ridiculous. It'd be like you could be a ditch digger and make the equivalent of today $100,000. So they thought, well, we'll give them perks like health insurance. And they'd give out these really great health insurance plans, which again, before World War II, they weren't doing that. Nobody was really thinking about health insurance the way that we think about it today. A lot of people did not have health insurance in America before World War II, less than 10%. That's how we got our employer-based healthcare system. It was perks designed to make up for not being as competitive with wages, while the rest of the world all had to do government-funded healthcare because their employers didn't have the money to spend on that. Flash forward to today, where we have employer-based healthcare, which is horrible. This is a huge conflict of interest to have employer-based healthcare. If your salary is $50,000 a year, but you have a very expensive illness, which 10% of America has what's called a rare disease and takes what's called an orphan drug. Okay, orphan drugs are manufactured for rare diseases. You know, one orphan drug will cost $1.5 million. Okay. This is what I saw on a show on FX called The Weekly, which is the New York Times went and interviewed this one family, a Boilermaker. His wife and two kids had this rare disease. It was almost $6 million a year. You can't tell me that employers do not look at that when they make decisions of who to let go, who to fire, who to promote, how long to keep somebody, can we phase them out, can we not pay them a retirement? Because if your health care costs are 100 times your salary, it almost doesn't make sense to keep you on the payroll and employed. And people say, oh, it's illegal. Now they can. Bullshit. We've seen how stuff is illegal and then people get around it somehow. So I think employer-based health care is an enormous conflict of interest. I don't know anybody who really likes that system. Pfizer and Merck and all these different companies, they say we have to charge what we charge for medicines because we got to be competitive. If we don't get that amount of money, then we're not going to have the money we need for R&D and research costs, and it's going to stifle innovation. Same fucking drugs they sell in Germany are cheaper. Same drugs. They sell their Viagra cheaper there than they do here because there's competition. So I'm not buying that crap. I don't think anybody should buy it. Pharmaceutical drugs, there's a higher markup on it than anything else in the world. Movie theater popcorn, the margins are not as good as for pharmaceuticals. If something costs them 2 cents to make and they sell it for $50 a pill, which you can, and that may even be low compared to some of the rare drugs and how much they cost, that is a scandal. It's like people don't expect a CEO to make the same as his workers, but it's like, can you make 100 times your workers versus 10 million times your workers? Same thing is it wouldn't be unreasonable to put price caps on these pharmaceutical drugs. Doctors, which that's something else people don't talk about, the AMA, the American Medical Association, they have fought a lot of healthcare reforms. They do it quieter, and people think like, oh, it's the bad guy healthcare companies. It's not my local doctor. Your local doctor won't take a lot of shittier healthcare plans. They won't take HMOs. California, they have something similar to a public option. It's basically an HMO that's so cheap It's basically government provided health care. We tried to get on it when we first came to Los Angeles, but the problem is so few doctors will take it. Almost no doctors will take that. This is the argument against a public option, is that it's great if you can get enough people on it that doctors will be forced to take it. But if you can't, then you've essentially got the system that you're on now. And you don't think about doctors as being greedy. And yet I've had multiple experiences with doctors where I'm in there and I'm just supposed to get an eye exam or something like that, and they go off on some bull wander about Michael Moore's full of shit, and if that movie Sicko happens, it'll be communism. So I think in terms of high-level professions, they're very conservative. They're much more conservative as a group than I think people realize. They're a lot less Mr. Rogers and a lot more Mr. Potter from It's a Wonderful Life. They like those pennies and those dollars. And of course, your local doctor, they get kickbacks from pharmaceutical companies that come in there and they say, hey, switch from this one diabetes drug to another. Well, does this new one cause heart attacks? Don't worry about that. Take a trip to Aruba. Then we'll see how much you like it. How about I put a fucking hottest girl you've ever seen as a pharmaceutical sales rep? This girl she couldn't make it as a Fox News anchor, but I'm going to put her in a shorter skirt and get her out here some from. Yeah, sure, that sounds great. The whole healthcare system sucks. You've got pharmaceuticals that have no prices, and people come in and you hear a lot of older people that say every doctor is foreign. Why is that? And I don't necessarily agree with that. But I think part of that is because we have the highest paying healthcare system in the world. You can't be a doctor in Cuba or Thailand or India and make $1 million a year. You can in the United States of America. So when people say, oh, well, our healthcare system, they're attracting the best doctors from all over the world. Yeah, because they pay them 100 times what they might make wherever else they're from. That may sound like it's giving you the best health care, but if you come in and the doctor is almost like, you know what, their health insurance just barely covers anything, and I don't even know if I want to fuck with it, and I can't really, prescribe them too many x-rays because their insurance won't cover it, so, fuck it, I don't even want to deal with it. It doesn't make any sense. It's the world's most conservative, least fair, least equitable healthcare system, and I don't blame people for wanting to tear it down.